My name is Jonathan Schiller. I'm a pediatric orthopedic surgeon here at University of Orthopedics. I primarily take care of children from birth until roughly 18. I always kind of knew that I wanted to do orthopedic surgery because I found that to be very much something that I could see a problem and try to fix a problem. The pediatric portion of it I liked very much because we could make a significant impact on a child's life. Whether it's you get a broken bone and you fix it and they're back to normal and doing what they like to do, or more complex things like I see with children with limb deformities or leg length discrepancies or the neuromuscular population. I found something to be redeeming in pediatric orthopedics, that you could really take someone and long-term affect their life, the quality of the life, the way they think about things, and really have a tremendous impact on the long-term happiness of a patient. A great deal of what I do is treating parents and making the parents feel comfortable.
Now we have an infected heel bone. You know what that is, right?
Yeah, we've already dealt with.
That said, I focus on the patient, which is the kid. And whether they're 5 years old or 15 years old, I speak to them. It's very important for me, regardless of whether I'm doing any surgery or I'm doing no surgery, that my patient understands what the problem is and how we are going to treat it, and then long-term what we need to do. Most parents appreciate that I speak to their child because it's the kid that has the problem. And I find that if I talk to the child, then the parents feel comfortable. Dealing with my own kids and how I deal with their injuries and just interacting with them and talking to them transfers to the office setting. I understand what the kids are doing on social media somewhat. The vernacular of the times, you know. I may not always be push and pee, but it helps me in the office to relate to kids. And the truth is I use my children a great deal of the time as an example with the kids. So they understand, all right, you know, Dr. Schiller understands at least somewhat because he's got 2 kids of his own and how he can interact with them, and therefore he must have some insight as to what I'm dealing with. I like to see how each kid interacts with me in the office, no matter what the problem is. That is what I enjoyed about my job, and that I can come in and have a kid that's totally flat and doesn't want to talk, is afraid of doctors, doesn't want to be on the exam table. Eventually, you know, my goal is that they are excited to come back and see Dr. Schiller, or however they want to mispronounce my name is fine. That's why I like coming to work. That's my enjoyment, is engaging with kids to really sort of help them feel better. Pediatric orthopedics in general, within our group, we operate differently. That's because we deal with children. And a great deal of what we do is non-operative. We approach it as a team. My partner, Craig Eberson, we kind of know what each other thinks and how we operate. And that goes with our nurse practitioners as well. We've really honed our practice to work with everybody and really be able to manage pediatric orthopedic problems as a team. What I don't do, like spine surgery, my partner takes care of, and stuff that I do, he does not do. And so it really works well. From the Rhode Island standpoint, or the regional standpoint, we are the only people who do what we do in the state of Rhode Island. Outside of Boston and parts of Hartford, Connecticut, and then going down to New York City, we're the only people in the area who do it. And the fact that we have that type of group here and that type of care available here is really something special for Rhode Island, because it doesn't exist anywhere else in the state.